Good morning, America. This is the Cats Roundtable, and this is John Catsimatidis, and this is the show that tells you what's going on Sunday morning in the world, in America, and what we should be concerned about. With us this morning is Dr. Philip Stieg, a well-renowned neurosurgeon and chairman and founder of the Weill Cornell Brain and Spine Center, and a leading neuroscience patient care center. Good morning, Dr. Stieg. How are you this morning?
I'm well. Thank you for inviting me, John.
Thank you for coming on again. And there's been a new study. There's been a new study that they have done brain injuries, a study on football players. And they did 111 football players, and 110 of them had very bad injuries. Can you tell America about what's going on with this?
For sure. What they are looking at, and this is done by a prominent group at Boston University, and they've been creating a brain bank of donors looking at football players. And they, in actuality, looked at 202 former football players, 111 of which played for the National Football League. And of that 111, 110 had evidence of neurodegeneration, which is called chronic traumatic encephalopathy. I think that, this is important news, and what we know from boxing and dementia pugilistica, which is a more common term that everyone's heard of, that head trauma is bad for us, and they have helped bring this newer histopathologic diagnosis called chronic traumatic encephalopathy, or CTE, to the forefront. That being said, I think that the NFL is now doing an excellent job of trying to protect its players, and we're trying to get that information down to the Pee-wee, high school, and college levels as well, and all of those groups are making advances. For the public, I think it's also extremely important for them to understand that this paper that's presented in the Journal of the American Medical Association cannot be used to assess the prevalence of this degenerative disease. You have to understand that they have taken 202 select patients, and that would be like taking 202 people that had a history of smoking and died of lung cancer. Of course, there would be a high correlation. What we don't know is how prevalent this process is. We do know that repetitive trauma is bad for people, and certainly it's bad for children, and we need to start enforcing the rules and changing some of the rules so we can reduce that and save our kids' lives.
So bottom line, you wouldn't let your son play football, would you?
I didn't let my son play football, but he played another contact sport, which is potentially equally as risky. The other important thing is that, that being said, that was actually, my son wasn't good at football. If he had wanted to, I probably wouldn't have gotten in the way. But if he did play, I would certainly be active at the sidelines, watching the way the coaches taught tackling, taught blocking, and things like that. The other interesting factor here in this study is that they looked at the positions that had the highest incidence of these problems. And, we always hear about the quarterbacks being blindsided and the tailbacks and the running backs. It turns out to be the linemen. And so I think that there's going to have to be some serious thought about what happens at the offensive and defensive line.
Now, are their helmets getting any better at protecting the brain or over the last few years?
Helmets are getting better. That being said, one has to remember that your brain is suspended in a body of water within the skull. And so even though the helmet might reduce the direct blow, the hit from helmet to helmet, it doesn't reduce the torque with which your brain can be rotated or shaken within the skull. And that's a problem that no helmet is really going to solve.
What else would you like to tell America on a Sunday morning?
Well, I think that America needs to know that the organized football. I sit on both a committee that works with the Big Ten and the Ivy League on concussion. I'm an unaffiliated consultant for the NFL. So one of the sideline doctors, which is supported by both the Players Association and the owners. That people are really taking this seriously now that there is a better understanding. If you look at what the age of these people that died, the average age was 66 years old, which means that they played football 30 years ago. 30 years ago, there wasn't this understanding to the degree that we have it now. I think that it's being taken seriously. Certainly if you're a mother or a father and your children are playing contact sports, and those not only include football, they include soccer, hockey, and for girls, basketball is a common problem for concussions. You need to be involved. You need to be watching your coaches and helping protect your children.
How about soccer when you hit that ball with your head?
That has been proven to be a problem, and for that reason, they've changed the age at which children can start doing headers. They've upped it to the age of 14 now. Gotcha.
Well, Dr. Stieg, thank you so much for interrupting your vacation and coming home with us, and we'll let you go back to relaxing.
I'm going to go hit the links. Thanks so much, John.